Hi, Dr. Matt Wiederholtz again. Welcome to part 3 of this series on low back pain. We've talked now about intervertebral disc disease, facet joint pain, and lastly, I want to talk about sacroiliac joint pain. The sacroiliac joint is a common source of lower back pain. In fact, up to 40% of lower back pain is pain from the sacroiliac joint. Unfortunately, many physicians overlook this joint as a source of pain, but here at Performance Spine and Sports Medicine, it's at the forefront of the treatment for lower back pain because it is such a common source of pain. The sacroiliac joint is formed by the sacrum and the ilium, hence the name sacroiliac joint, and you've got one on each side. The sacroiliac joint is this joint right here. As you can see, it's a very irregular joint, and the reason for that is it's a joint of stability. Unlike the shoulder joint or the hip joint, which have tremendous range of motion, the sacroiliac joint is a stabilizing joint. It has interlocking joint surfaces, and what that does is it adds stability to the pelvis. That stability is extraordinarily important. There, in fact, is only about 3 degrees of motion at that joint. That's an important 3 degrees, but what we see frequently is hypermobility of that joint. When we go above 3 degrees, what happens is those joint margins tend to rub up against each other, and that causes pain and that causes inflammation. There are several ligaments that support these joints, and those ligaments are of utmost importance. When those ligaments are injured, sprained, or even cut during surgery for the lower back, what happens is the pelvis and the sacroiliac joint become hypermobile. There's increased motion at that joint. Patients with hypermobility of that sacroiliac joint tend to have significant pain. That pain is often described as a dull, aching pain with intermittent, sharp exacerbations. That pain can stay in and around the buttock area, or it can even radiate down into the leg, most commonly into the thigh, but it has been described to go down into the leg like sciatica. Here at Performance Spine and Sports Medicine, the medical doctors will do a comprehensive evaluation to determine whether or not your pain is coming from the sacroiliac joint. As part of that diagnostic workup, we frequently do diagnostic injections into that sacroiliac joint. It's a very, very quick injection, takes almost no time at all, and gives us immediate answers as to whether or not that area or that joint is a cause of pain. Once that diagnosis is confirmed with a diagnostic injection, we go after treatment. Treatment consists, as you know here at Performance Spine and Sports Medicine, of an integrated approach. Physical therapy is going to strengthen the muscles that span the sacroiliac joint, adding stability to it. Chiropractic therapy is used to align any malalignment not only in the spine but also in the pelvis. Oftentimes with sacroiliac joint pain, there is an obliquity of the pelvis, meaning a tilting of the pelvis. And by realigning the pelvis, the therapy can be significantly increased in its benefit for you. Some patients, however, probably about 40 to 50%, that won't be enough. And what we offer for those patients is something called regenerative injection therapy, or prolotherapy. That's injection of a solution into the ligaments that span the joint in order to thicken and strengthen those ligaments to add stability to that joint. Unlike cortisone injections, prolotherapy, or regenerative injection therapy, is not a quick fix. There's not an immediate result. What we're doing is we're actually stimulating your body's own natural healing ability to provide that increased stability, and that takes time. However, most patients, if not all patients, will respond in a positive way to regenerative injection therapy when it's combined with an integrative approach of physical therapy and chiropractic care. That concludes this segment on sacroiliac joint pain. Any questions, please comment on the blog or call us for an appointment. We're happy to discuss the causes of your lower back pain. So just to sum up, we've talked about intervertebral disc pain, lumbar facet pain, and sacroiliac joint pain. Those are the top 3 causes for lower back pain when dealing with structural issues. That probably makes up at least 80% of all lower back pain. So here at Performance Spine and Sports Medicine, we have the treatment for any and all of those common causes of lower back pain.